Now, St. Louis County Executive Dr. Sam Page joins us live. Dr. Page, thank you so much for taking a few minutes to speak with us this afternoon.
Good afternoon.
Well, we know you sent a letter to the governor asking for help from the Missouri National Guard. Walk us through the requests in that letter and why you felt the need to do this.
Well, this is something we had planned all along. This is an important part of the process where we look for help to supplement our people here in St. Louis County and to replace some of our medical personnel in the testing sites so they can go back to the hospitals and help, and our Guard can provide some of those medical assistant type testing services in the testing facilities in St. Louis County. In addition, they can help with providing security at the hospitals when they're needed, and also can help with transporting patients and materials in the county. And we anticipate at this point that we'll receive about 50 members of the National Guard to help us. If we need more in the future, we'll certainly ask for it. This is not a deployment or anything like that. This is just a supportive role.
When you talk about security, are you seeing any county hospitals or facilities that need security help right now?
No, but they do have their own. Every hospital has security personnel, and these hospitals are now functioning at a very high capacity. They've done some extraordinary things to increase their capacity, and they're going to be very busy.
Where does the county stand? Give us an idea with PPE equipment for medical staff and for first responders. We know this has certainly been a struggle for the county, the state, states across the country, really.
Right. Yeah, PPE is a struggle across the nation. And here in St. Louis County, we spent about $7 million. We have a warehouse with about a 30-day supply, but we know that supply is going to be accessed very promptly over the next couple of weeks. We have shipments coming in. We're going to try and stay ahead of it, and we believe that we can. We've taken some conservation measures with our first responders and everyone else using our PPE, and I know the hospitals have taken conservative measures as well. Their supplies are tight, but right now they have what they need.
We know you have taken the measure to close county parks the last few days. Today included in that, we're seeing a lot of sunshine, really summer-like temperatures. What are you seeing in these county parks? Are people obeying the orders that you have put out there?
Well, we haven't heard any more complaints about crowding. It was a very, very difficult decision. We looked at our Google Analytics on our maps in St. Louis County. We saw that travel to businesses around the community was down. Travel around the community was down 30 to 50%. Unfortunately, in our parks, it was up 87%. And we really don't have the park rangers right now to deploy to disperse crowds. Those are now helping with our policing and other first responder needs in our community, as some of our first responders have been infected with COVID-19 or otherwise in quarantine. So we had to deploy our park rangers elsewhere. We also knew that as the state closed some of their parks, that movement would push into our county parks and they would be crowded even more. And at this point, our number one goal is saving lives. We were very, very difficult decision to close our parks temporarily for the next couple of weeks.
Dr. Page, we get a lot of emails, a lot of phone calls from viewers wanting to know how many people have recovered from COVID-19. They're looking for any sort of optimism and positivity that we can get in this. Is the county keeping track of that information? And if so, would you be able to release those details?
Well, there's no way to even get that information on the national level without a robust testing environment. We do hope in the next couple of months we'll have a blood test for who's acutely infected and who's been exposed to COVID-19. That's an important part of our recovery, an important part of getting through this epidemic. But without that information, we can't even tell who's been infected. We know that 25 or 30% of individuals who have a COVID-19 infection never show symptoms, or symptoms are so mild that they aren't recognized. So we really have no way of establishing that data right now. There's no measurement tool.
We know we unfortunately haven't seen the worst of this in St. Louis County. When do you expect it to peak in the county? Are we talking about a few weeks, more than that?
Well, I would follow the lead of Dr. Garza with the epidemic task force that's been put together by our health systems. They have a good predictive model, but again, the models are just that. They're a prediction based on information we have today. And tomorrow we may have new information and our models may be adjusted. But with the information we have today, we expect that in the next 10 days to 2 weeks.
What are we missing here, Dr. Page? What information do we still need to get out? Do you still want to get out to our viewers?
Well, first of all, you see that I have my mask here. I took it down so I could talk to you, and we are at a safe social distance. But when you're out in public, a cloth mask is advisory. We got that information as a new development, new information from the CDC a few days ago. We especially would like to see people using a cloth mask, not a surgical mask, not an N95 mask. Those must be reserved for our hospitals, doctors, and nurses and first responders. But these cloth masks do have a protective effect when social distancing isn't perfect, such as a grocery store or some other necessary environment. And we especially want to recognize our grocery workers who are really on the front lines of making sure we have access to food during this tough next couple of weeks.
Yeah, certainly couldn't help but notice your St. Louis pride in all of this, St. Louis Cardinals there on your mask.
Thank you.
All right, Dr. Page, thank you so much for your time this afternoon. We hope to speak to you again soon.
You bet.